no way if you saw that 50 slides, so there's no way that I'm going to stay on time. So I'm counting on Matt throwing something at me at about 20 minutes in. Yes, do that. That's good. I saw 50 slides. I've given this talk, about 6 hours worth, right? So we're doing this in 15 minutes. Okay, so this is the Reader's Digest version of the Reader's Digest version. The only time I've been on time giving a talk is when I was in grade 5 and I was talking my baseball cards. So I'm not known for being, on time at all. So what we're going to talk about, the objectives really quickly, is just talk about how you manage these things, both acute. So right off the bat, what do? Really 1 or 2 slides on neuroimaging, so how we take pictures of the brain, why we generally don't do it, some easy steps to take, what we do with the chronic concussion, what the future holds, and if anybody falls asleep in 15 minutes, I think we need to top up the coffee a little bit. But this is, like I said, I'm going to talk really, really fast, so I think a lot of this is going to come after in the discussion. But there's other things that we'll talk about is prevention and the long-term effect. This is the reason why I really focus on these talks, is talking about the long-term, the chronic traumatic encephalopathy and those sort of things, and maybe we can talk about that a little bit later. So I tell people you picked a bad time to get a concussion, because right now we are at the tip of the iceberg, right? We really don't know a heck of a lot. But every week I'm getting about 24 studies sent to me, so the amount of information that we're gaining every week is just phenomenal. And the way that we manage things now is going to be really different from how we manage things probably even 2, 3, 4 years from now. So, pathophysiology in 30 seconds. So why this is, I gave a 2-hour talk on this one slide alone. We're going to do this in about 30 seconds here. So this is what I explain to parents about the basis of what is concussion, and we've talked about it a little bit. But the way that I explain this to parents is, I don't know if you know, perfect. So this is a cell in your brain. You have billions and billions and billions and billions of these, and every microsecond of every day your brain works very hard at keeping certain imbalances in check. It likes to keep things like potassium, right? It's bananas inside the cell, sodium outside the cell, salt. But when you get hit in the head, you have a concussion, your body loses its ability to control this gradient and thus its ability to talk to itself. Other things that happen is calcium comes into the cell. Calcium causes these cells to swell a little bit. You get glutamate, which is this weird neuroprotein right here, binds to something called NMDA receptors, which interferes with how you talk. And then finally, you get a cramp in your brain. So cramp, when you're running, if I walk up the stairs now, I get a cramp, right? And that's lactic acid being produced. And that happens in your brain, and that's not normal. So all these different things together give you your symptoms, right? And every single concussion is going to get better. As long as it's only a concussion, you don't have the anxiety and the depression, all these. But I tell kids, every concussion is going to get better, but it takes time and it takes energy. That's where the whole theory of cognitive rest comes from, and physical rest. The less you do, right, the less texting you do, the less video games you do, the less energy your brain uses for other things, the more energy your brain has to correct the imbalances that are going on, to pull in that potassium, to push out that sodium, to mop up that glutamate. So that's the general principle of why we rest at first. All right. So fast forward. Kid has a concussion. All right. What do you do initially? Well, if something bad happens, a lot it's going to be within the first 24 hours. Please don't wake up the kid every 2 hours. It's going to make you angry. It's going to make the kid angry. If it's a bad injury, I do say wake them up once. Just give them a drink of water. Make sure that they're coherent and that you can wake them up. There is some literature, most notably out of Japanese boxing studies, that epidurals can frequently happen. That's a head bleed. Sorry, can happen and not present for another 2 weeks. But those are more exceptions to the rule. Warning signs, all right? These are the warning signs. And I'll make these slides available to Matt too, so if you want to email Matt, you can get these slides. So these are the worry. These things, when you don't see me, this is when you see somebody like Dr. Vassiliadi, because if you come see me with these things, I'm just going to point you in his direction anyway. These are the scared things, right? So if you can't wake them, if they have a worsening headache, the headaches for me, they're the most scary, the ones that are in the posterior, but they can happen anywhere. If they're getting worse, if they're associated with vision change or vomiting, if they lose ability to control their bowels or their bladder, any sort of stingers, we call them, shocks down the hands or down the legs, those are all things that warrant a little bit further investigation. Now, neuroimaging. Why do we image and why do we not image? Last week I just got up and I gave a talk to 200 ER doctors encouraging them not to do CT scans, right? So CT scans show you the big and the bad. They're not going to show you concussion. No imaging that we have now is going to show you a concussion. A concussion is what we call a functional injury. It's not a structural injury. Why do you get a CT scan? It's to rule out a skull fracture. It's to rule out a head bleed, right? It's equivalent to about 300 x-rays pointed right at your head, right? So that's a lot, in a world full of radiation, that's a lot of radiation. So you should not get CT scans unless you think that something very, very bad is going on. MRIs, why do we get MRIs? I think the Ontario government doesn't like me very much because I order a lot of MRIs, but only for the very complicated cases and only if someone's having persistent symptoms, generally for more than 3 months, right? And it's classic symptoms. Every concussion is a little bit different, but what do you look for when you get MRIs? And again, this is 3 months, 6 months worth of symptoms. You look for things like this. This is a 12-year-old boy that came to see me. He was playing tackle baseball, and he had 5 concussions, and he was 3 months or 4 months after his 5th, and chronic headaches in the back, worse when he cried and when he laughed and when he pooped, right? And what happened was he has something called a Chiari malformation, so it's only in about 1% of the population, but you can see part of his brain, called the cerebellum, controls a lot of the balance. It's actually poking through the bottom of his skull, and that's what's causing his problems. This was a college football player that wants to be cleared, and he had a big, I'm not even trying to go back, but he had a big bleed in the back, a cyst in the back of his head. 3, 4, 5, 6 years from now, there's going to be something commercially available, and it's going to be an imaging modality where you can actually see concussions, right? So if you look at the one on your left, that's a functional MRI. It looks at brain metabolism. You can look at the picture, the set of pictures on the bottom, you can see increased activity in a kid with concussion versus a kid that doesn't have concussion. Another different version, and there's about 5 or 6 of these. They're all kind of jockeying now for position about which is going to be the modality of choice, but this is called the diffusion tensor imaging. This measures water flow in the brain, and it measures something called fractional anastrophe. And when you have a concussion, water does not flow linearly, does not flow straight in the brain, so that's what this says here. You can see this little red spot. This red spot is consistent with poor water flow and increased fractional anastrophe, which is consistent with seeing a quote-unquote concussion. Now, treatment. How do you treat these things? Well, when I was at Harvard before this, and even now, we're seeing people coming from all over the world, all over Ontario, with 6 months, a year, 2 years worth of symptoms. And if they came and you said, well, drink water and rest, they want their airfare back. So you have to start thinking a little bit outside of the box, right? So you have these traditional schools where it says, oh, just rest, you'll get better, to a newer approach. You have to look at, all right, is this acute? And I manage acute injuries, so injuries within that 7 to 10 day window, which I very rarely ever see anymore. I always see the chronic kids with months and months and months worth of symptoms. You also have to look at concussions as a brain injury. It's not just going to simply go away. I mean, I see kids that have been out of school for 6 months and 12 months. So you treat these a lot differently than you would the kid with 7 to 10 days worth of symptoms. The principles that I use, the first goal, right, is to get them back to school and back to work. I tell kids school is your job, right? Sports and everything, that's just bonus, right? My goal is to get you back as quickly and as safely as possible to school, and then to sports. Medication is always a last resort. So when you clear someone to go back, you have to medically clear them, right? So they're not at any more risk of getting a head injury that's going to cause something like second impact syndrome or something like that. You have to make sure that they're emotionally ready, that they're psychologically ready, and if you're putting them back to sport, you have to make sure that their cardiovascular fitness is back. So it's not just saying, all right, it's safe. You have to look at all those other domains and make sure that they're in fact ready to go back. All right, so we talked about limit cognitive rest, and we talked about why that is. So I pull kids out of school all the time because the purpose of being in school is to retain information. When you're acutely concussed, there's no way you can retain information. The only thing that's happening from you being in school is all the stimulus is being thrown at you, whether it's the teacher yelling at you, whether it's the light, whether it's the sound, whether it's all your friends talking to you. It's a huge cognitive load, and you're not learning anything from being there. But saying that, if you're not going to be in school, you're not texting, you're not video games, you're not Facebook, so it's amazing how fast kids get better when you start taking those things away from them. You can't pull kids out of school forever. I often push kids back into school when other doctors have said, all right, well, still wait, because if you pull them out of school for too long, you're socially isolating them, they're becoming depressed, they're falling behind, they're getting stressed, all these other things. So I've seen about between 2,000 and 3,000 concussions at this stage, and every concussion you treat differently, right? So I'm going to get one kid back to school a lot quicker than I would the other if I'm thinking, well, geez, this kid is going to be at risk of getting significantly depressed. And I've had kids end up going to CHIO, with bad mental states for suicidal ideation and that sort of thing. So it's a balance. Same thing with the physical stress, or physical rest, right? So I have never been in the school that you should take a healthy 16-year-old boy or girl and make them sit on the couch all day. That's what we do for professionals. But I think when you start doing that, other things start to set in. So I think from day one, as long as a kid can stand and walk, I think they should be going for therapeutic walks. It might just be 2 minutes around the driveway, it could be walking down the street, but getting the blood flowing, getting some fresh air, I find therapeutic. There's a guy from the University of Buffalo named Dr. Letty that's putting out some literature, at least now for the chronic kids, that therapeutic exercise can actually be therapeutic. He's working on getting something more in the acute phase, but I think walking is not going to delay your recovery to a significant amount. You have to get your sleep. Like was discussed earlier, people with concussions have sleep dysfunction, so you want to get them back on a healthy sleep style. Hydrate. What's one of the most common causes of headache? Well, it's being dehydrated, right? I can't tell you how many kids come in and their lips are chapped, and you can just tell that if they were to pee, it'd be bright yellow. So it's talking about making sure that they drink so much that their pee is clear and they're peeing every 2 to 3 hours. Diet, right? The same thing. I never have lunch. I always work through lunch. So at the end of the day, I'm feeling anxious and I'm feeling tired, I'm feeling grumpy, and I have a headache. All these things that concussion kids have to, but it's not because I have a concussion, it's because my glucose is low and I'm tired, right? So it's very important for these kids to eat a frequent, healthy snack. The U.S. military had an unpublished study that looked at 4,000 soldiers, and it found that 2,000 soldiers that ate a lot of protein got better quicker. So I often say, again, have a protein-heavy diet. I warned you guys I was going to be talking very quick. I realize I'm going very fast and trying to get through the remaining 55 slides here. So eating well is very important, and supplements. So we'll get to that in a minute. So with sleep hygiene, generally, there is a good literature about melatonin, and for those of you that do not know melatonin, it's a hormone that's released by your pineal gland, and it tells your body when it's time to go to sleep, right? Now, it does not cause you to be groggy, it's not addictive, and it's not toxic. Don't listen to Dr. Oz. At very mild doses, it's very, very safe to use for short periods of time. Now, and there's literature that independent of the sleep benefit, it can actually help you recover a bit from a concussion. Now, the doses, I'm not going to get into what doses to use, but if you use it at reasonable doses, it's very, very safe. But the other thing is, if you're going to give melatonin, you have to make sure that kids having proper sleep hygiene. So no caffeine, no significant sugar after 6 p.m., no screen time. Every time you look at a screen, that's ambient light reaching your optic nerves, telling your brain it's not time to go to sleep. So no screen time an hour before you go to bed, no significant physical exertion an hour before you go to bed, and use a bath and calm things down before you're going to sleep. A bed is only for sleep, right? It's not for texting, it's not for computers, not even for reading. When your brain needs to be trained, when it sees that bed, it means it's time to go to sleep, right? So all those basic sleep hygiene things. Now headaches. Often what I do is, all right, give you a headache diary. So try to learn more about these headaches. Is this headache due to a concussion, or is it due to the fact that this is early onset migraines? There's something called a confusional migraine, which by definition is a migraine induced by contact, right? Well, to me, that's a concussion, but it's just nomenclature, it's just logistics. But I've seen many times that kids think that it's a concussion headaches when it turns out that no, it's actually the earliest onset of migraines. So you try to find their trigger, right? So is it every time they have red food coloring? Is it every time they have chocolate? Is it every time that they have hot dogs? Is it every time they only get 6 hours of sleep? Is it only every time that they're excessively stressed, right? With the common triggers for migraine. I don't recommend ibuprofen consistently. Ibuprofen, it's like coffee. If I don't have coffee in the morning, my brain gets angry. And the same thing can happen if you use too much ibuprofen consistency. If you're using it 3-4 times a day for 4 days, you stop taking your ibuprofen, your brain's going to get upset. Tylenol doesn't really have that rebound effect. So additional tools. All these different things here, right? And the first one he says is talking it out. I think every teenager should be forced and handcuffed to a chair to talk to their guidance counselor twice a year. Could you imagine how much less depression, suicide, bullying there would be if kids going through this very stressful time in their life full of transition could have someone there so they could get things off their chest and someone to give them tools to deal with everything that they're dealing with. Huge thing with chronic illness. We know that people that are dealing with chronic illness, right, they're more likely to be depressed, they're more likely to have headaches, they're more likely to have back pain, more likely to have all these different symptoms. So whenever someone has symptoms for 3 months, I say, all right, you have to go talk to somebody, right? And That's a whole story in itself. Physical therapy, right? Massage therapy, vestibular therapy, all these different types of modalities that really have no side effects, right? And that's another thing, but there are lots of things that you can do initially. I always look at a kid's neck. You can't get a concussion without your head moving, right? Look at woodpeckers. Why are woodpeckers not chronically concussed? It's because evolution is fantastic. They've evolved this tongue, right? That every time their head moves, their tongue shoots back to their brain, stabilizes their brain, so even though that their head is moving, their brain does not move, right? So technically, you have a concussion when your head moves. So your neck is going to be involved at some point. I can't tell you how many times I pick up, a significant muscle spasm in the neck, and I give a script for soft tissue mobilization, which is just insurance lingo for massage. So I give kids a ticket for a massage, and they love it, right? All these other things that can help. Now, when kids come to see me, I tell them I could turn you very easily into an 80-year-old woman with their little pill box, and you have to take 15 pills every single day. But there are a couple things, Cure for Men, there is some literature, this is found in curry, but to get a therapeutic dose, you have to have 8 plates of curry a day. The second one, right, that's red wine, we're not going to go there at all. Creatine, green tea, caffeine, there's all some quote-unquote literature out there that says it might be helpful, but things that I do recommend, omega-3s, right? I use omega-3s, it's fish oil, right? I use it for kids with behavioral disorders, for ADHD, because there's some literature, right, that it can help, right? It can help prevent concussions, help limit the long-term effects of concussions, help you recover from concussions, right? But at whopping doses. If you look at the best natural source I know is salmon. You get 300 milligrams in one dose. The highest dose I've seen in the literature for a group of 16-year-old ADHD kids was 16,000. Right, so you're not going to have 5 fish a day to get that amount. So it's very, very safe, and a study just came out that is associated with a decreased risk of Alzheimer's potentially. So we all should take it. It's good for your heart, good for your blood pressure, all those other kind of things too. All right, so this is a return. This is something we developed down in Boston. So return to cognitive activity. So you look at this complete stage rest. So you don't do anything, right? You're brain dead. Say, all right, you listen to ambient music, not earbuds, but Mozart. How many 16-year-old kids like to listen to Mozart, right? But there is studies in premature kids and rats that Mozart in particular can be therapeutic. So you can listen to music, you can talk on the phone, right? That kind of thing. So you're not doing a heck of a lot, and then you progress down through. And then return to play in terms of physical activity. And normally it's a 7-day rule that I think Peter alluded to, and that was based on a study in 2003 by a guy named Gutzwitz, and he found that if you were going to get a second concussion, 85% of the second concussion happened within 7 days of the first concussion, and 92% of them happened within 10 days. We don't do that anymore, right? It's not these blanket rules. Every concussion is different. That's why I stress to parents is that every concussion is different. It's an individualized process for everybody. We know that there's a study that came out that when you get hit, you get your bell rung and you see stars, or you get those wobbly legs after, just for about 2 or 3 seconds, that your brain does not return to normal for 7 to 8 days, right? So even after your symptoms are gone, there's a significant lag period where you still are vulnerable for repeat injury. This one-to-one rule, everything that I do is based on evidence medicine, except for this one-to-one rule. This is a rule that I use that says, all right, I want you asymptomatic 1 day for every day that you were having symptoms before you can go back for contact, right, up to a month. So if a kid has a month worth of symptoms, right, he's going to be out for a month before he can go in full contact play. And that takes into account, right, that lag period that we just don't know how long it is, but it gives us a safe buffer, right, to say, all right, you had symptoms for a month, but you haven't had symptoms for a month now, it's safe for you to go back. Because face it, 99.97 kids are not going to play in the NHL, right? And tell them you're going to pay for your parents' retirement with what's between your ears. It's not, with your legs, so we got to protect your brain. And this is how we would progress people through sports, right? This is available online. The best probably summary that's available right now is from the Zurich guidelines. If you want to read it, it's free online. Type in Zurich 2008 concussion guidelines, and there'll be a new one coming out in the middle of March apparently. But for a good summary, Zurich 2008 concussion guidelines, and you'll get a good summary of what's going on. Return to activity. So look at stage 1. So as soon as the kid is having, as long as the kid is having something, like, not supposed to be doing anything. I don't agree with that. Again, I say, all right, we'll go for walks. Then you go down to number 2, right? So when the kid is back full-time in school, right, I like them to have a quiz or a test just to prove that they can think normally. They start with light aerobic exercise. And ideally, an exercise bike is best, right? An exercise bike, it keeps your head nice and level, but more importantly, it's a constant intensity the whole time. And that intensity that we want is 70%. So 70% your max heart rate, okay? What does that mean? Well, it means after 20 to 30 minutes on the bike, you've worked up a little bit of a sweat, but during those 20 to 30 minutes, and that's going to grab something and throw it at me right now. 20 to 30 minutes, you've worked up a little bit of a sweat, but you are never out of breath. You can always maintain a normal conversation when you're doing that. If you can do that, and it's anywhere from 1 to 7 days, if you can do that, you go down to sport-specific activity. And for me, for hockey players, this is not when you go back on the ice because you're still vulnerable for repeat injury. This is where you're in the driveway shooting 100 pucks. If you're a basketball player, this is you doing free throws and layups. So you're mixing a little bit of thinking with a little bit of physical activity. And then you progress to the non-contact training drill. So this is when you can do a little bit of drills, pick and rolls, or if you're playing basketball, you can do the serves and the jump spikes in volleyball. You're wearing the red penny and skating through drills if you're playing hockey. And then you come and you see a medical professional, whether it's a doctor, athletic therapist. I mean, there's no real consensus now about who should do it. But you say, all right, it's safe for you to go into contact. So for a hockey player, you say, all right, you can go get a puck, jump in the corner with your friends, right? Try to bump each other on the premise that, all right, you can take some hits from somebody that cares about you before we throw you to the wolves and have people trying to hurt you, hitting you, and giving you a really big impact. So treating the different concussions. Do I have 2 minutes left, or am I done?
Sure, you can have 1 minute.
1 minute. All right. It starts with blood work. You look for something called neuroendocrine dysfunction. Back in the 80s, the Russians found that people that did not respond well after some minor traumatic brain injuries had abnormal hormone levels, but I also look for other things. In a 16-year-old with sore throat, with fatigue, I look for mono. I was telling Dr. Bassiati today, I had a kid that had a chronic strep infection. That was causing all these fatigue things. I mean, there's a lot of different things that go into this. Headaches, I use lots of different medications, but remember, this is always the last resort, right? This is months into this thing. This isn't the kids that just don't do well, that have nowhere else to turn, right? There's lots of different medications that you use. Feeling like in a fog, there's medications that we can use for that. There's medications that we can use for focus and concentration. There's a lot of different other things. You can look at this huge list of different medications. So there are things that you can do that there is evidence in the scientific literature that you can help for those chronic kids. Pending issues, there's a lot of pending issues, and the format hurts me. I'm going to stop right there. All right, thank you.